everyone. Welcome back to another episode of the podcast. Today, we are talking about something that's more in the mental health space than in the coaching space. This is a little bit of a deeper dive, and one that I've been wanting to do for a while because there's so many issues in mental health that we don't talk about enough that so many of us deal with within ourselves, our families, our family members, and or our friends. And so I wanted to do an episode today on mental health, specifically depression and substance abuse. So often, I mean, how many of us today don't know somebody who has not in the past or isn't now struggling with some form of substance abuse? And often that is related to an underlying mental health issue like depression and anxiety. So we're going to do, actually, this is a 2-part series on depression and substance abuse.
Nice.
All right. So buckle up.
Buckle up.
So I wanted to start off with, what does life look like for somebody who is dealing with a clinical depression and is abusing substances? So I'm going to go into that first. Okay. So if you're depressed now, okay, I got to go back and put in this caveat. Remember that when you're listening to this podcast, this is really a very generalized statement to you. Okay. I am not your therapist. I'm not even your life coach. I am on here on this podcast and on YouTube to really give you very general, my knowledge and insights based on my 30 plus years of practice, but that I'm not your therapist. And at the end, I'm always going to tell you, if this is something that resonates for you, go find somebody to work with you personally. So if you're the only people that I can work with as a psychotherapist are in the state of Illinois. But remember, even if you're in Illinois, I'm not your therapist. And I think this is beyond coaching. I would not see a life coach or a coach for something like
about this.
Yeah. It's a strict boundary
just
for me.
Based on what we're talking about. There's no way. It makes no sense.
Yeah. So, all right. So now that I got that caveat out of the way, so what is somebody with depression dealing with? Well, now there are different levels of depression. I think there's 9 subtypes under the category of mood disorders in the DSM-5. So major depressive disorder is just one of several subtypes of depressions. So for many people, there is a sense of persistent sadness. So that's a symptom. Somebody just feels, and remember, you wouldn't know it by looking at somebody on the street. You wouldn't know it by meeting somebody in a restaurant or in a cafe or in a bar, that they're dealing with a persistent sadness. Many people can cover it up and you just wouldn't know. Okay. So that's really important. People who are struggling with depression also struggle with anxiety. And I've said it on the podcast before. I say it all the time. Depression and anxiety are bedfellows. They often are, 2 sides of a coin. One side's anxiety, the other side's depression. Many people who are dealing with depression are suffering from low self-esteem. So, there's a significant decrease in their sense of self-worth, thus how they esteem themselves as a person. Someone with depression, you're going to see guilt and shame. There's often guilt and shame for why I am dealing with what I'm dealing with. And when we are depressed, our thoughts get so distorted. It's like we just can't see ourselves straight. We can't sometimes see the light at the end of the tunnel, or we know it's there, but it's very dim. And that often we feel flawed. I've dealt with depression when I was going through my divorce 20 years ago. It was a deep depression and a terrible time in my life. And one that I think, 2 things that got me out of it was my therapist, who I was seeing twice a week for 2-3 years, and taking an antidepressant, which I took for 5 years. Sertraline, which is generic, was Zoloft. 25 milligrams, 50. Then I went to 75. 75 was too much for me. Went back down to 50, hung out at 50 for a while, hung out at 25 milligrams for a few years. And that was the secret number for me until I finally went off it. But, there was guilt and there was shame that I was dealing with what I was dealing with. Why am I depressed. And for those on the outside who see their loved one or the person they care about, and they're like, why do you have guilt or shame around this? You can't talk somebody out of it who is depressed, because we got a jumble of stuff going on in our heads. And it really takes the work of a professional to help us through it.
Yeah. I mean, you don't really know what that person's got inside their head, right? Only that person does, right? And it's like, you want the best for that person as their loved one, but even then, it's like you can't possibly imagine what's spinning inside.
What's going on inside of them.
It's not possible.
And for the person who is depressed, it's hard to articulate it. It's hard to find the words to articulate to another person just what it is they think and or what it is they feel. And if they did tell you, they worry that they would be judged, that their thoughts are stupid, or the really what's worse is that toxic positivity of, don't worry about it, you'll be okay. No, you have no freaking idea what I'm feeling. And that is so not helpful to somebody who's struggling with a depression.
I mean, no one would know all the details, and all the details are the things that are bothering you, right? So the details really do matter, and they're no one else's business most of the time, right? So it's like, because of that, no one's going to really get the full effect of why you feel the way you feel.
Yeah. And just remember, if you have somebody in your life who is depressed and maybe they've, indicated that to you to some degree or another, remember, if you've never been depressed, you don't know what it's like unless you walked a mile in their shoes, and you'll never walk a mile in their shoes. So remember that. So suspend judgment.
Right.
And the final one for somebody who is dealing with depression is isolation. Isolation is common. You're down, you're depressed, you're not motivated, you don't want to go out, you don't want to have any, people over, you don't want to go to someone's house, you really just hold back from social activities, whereas maybe in the past you didn't. And you care less about seeing family members and friends. So, that is really, really common. And we saw quite a bit of it actually before COVID. In 2019, I've talked about the big Cigna study that came out that studied 75,000 Americans and the epidemic of loneliness and isolation that was going on pre-COVID. Well, what do you all think it's like now, right? What do we all think it's like now? It's been a hockey stick uptick in mental health issues, depression, namely being the top, with anxiety.
Yeah.
Okay. So, all right. So let's go on to the physical health of somebody who's dealing with a depression. So, somebody who think to yourself about someone who's depressed. What do you think their physical health is like? It's probably not the best. It's probably not ideal. And I've seen it in people who, they worked out, they had a fitness routine, and they were eating, air quote, eating really well. I was going to say eating clean, but I'm tending to not like that term more and more. They're eating well. They had a social life. They saw their friends, but they just went through, and for many people, this is biochemical. It's like their genetics. They just went through this depression. And what happened? Their physical health falls off. They stop working out. They stop going to the gym because it's so, so difficult to get your butt up and work out, go to the gym or work out in your home. It's just so difficult. It's like all of a sudden somebody put a wet, heavy blanket around your shoulders and you got to pick yourself up out of bed and get yourself. It's so very difficult to do. So you'll see physical health going a little bit down the tubes.
That could be even like, you're not sleeping well, right? Yeah. So you're walking through life kind of glazed over because you're not able to sleep maybe soundly throughout the entire night.
Right. Insomnia is a big piece of it. Yeah. Early morning awakening is another symptom of a clinical depression where you go to sleep okay, maybe at 9 or 10 or 11, but you wake up early for you, which usually it's around like 3 a.m., 4 a.m., 5 a.m., and it's early. That's a symptom of depression, which I think gets missed a lot by people. So, we've got the chronic fatigue. You're not sleeping. So take the heavy, wet blanket, put it on your shoulders, and give someone 5 hours of sleep. I mean, just you think about it for a minute, Tim or me. You're exhausted. Yeah, you're exhausted. Yeah, right.
You're definitely not on your A game when it comes to having to deal with things during life, right? During the day.
Right. So can you understand how maybe for somebody who's dealing with a depression, why maybe their first choice is to turn to alcohol and or drugs? if they're not, many people, their first thought isn't, hey, I'm going to go and find a psychiatrist and make an appointment to get on meds, or I'm going to go find myself a therapist. Some do, but many people, we minimize how depressed we are. We minimize how bad it is. But what we often find unwittingly over time is that we're drinking more, we're taking pills more, we're taking, like a Xanax or a Valium to, chill ourselves out, to help ourselves take an Ambien to help you fall asleep, to help you stay asleep. Next thing you know, because Ambien, these drugs are addictive. Next thing you know, we are taking it 3 nights a week, 5 nights a week, 7 nights a week. And look, now we need more to get ourselves to fall asleep and stay asleep. This is an addiction or dependence. I'll start with dependence, a dependence in the making. Or you're down and you're tired of feeling down. So what are you going to do? Maybe you're going to take an amphetamine to boost yourself up. So, we're self-medicating with, street drugs, marijuana for certain people, which we could get into that a little bit more because marijuana is probably the worst thing for depression. You're getting high, or you're drinking more, or you are, taking something to give you an upper, like maybe, or you're looking for some cocaine. You tried cocaine once. You remember how that made you feel. So now it's like, let me get myself some blow because I know how that makes me feel. And I feel pretty revved up, and I'm, that's what I need. I got to get my mind back. I got to get my thoughts back. I got to get my energy back. I got work to do. I got to write. I got to go to my job. Let's get some coke. And that's just, or methamphetamines, or,
whatever.
Right.
Yeah. There's
Right.
the long list, right?
So the behavioral patterns of somebody with a depression can be, who moves into substance use and abuse, is going to these drugs to help them get out of what's underneath this depression, which is a horrible, it's just really a tough way to live. I've been there. I know what it's like. I wouldn't wish it on anyone.
Yeah. So this is interesting. So if you think about, I mean, even if you're not in a state of depression, right?
Right.
How many times, like you used to work in a office, right? Like
Right.
you don't now, but you used to. But like how many times, like you have like a rough day, and it's crazy. And what is the statement? And there's no judgment. I've done this too, right? Like it's like, oh my gosh, I need a drink, or oh my gosh, like let's go to happy hour. You know what I mean?
Right.
So just in terms of a human, not everybody goes that direction, but that is something that many people go towards, even when they're not in a state of deep depression.
Right.
So if you take the person now and you add depression to this equation, just imagine the magnification now, right? To this.
Right.
You're talking about massive amounts, right?
I mean, not everybody who likes to have a drink or drinks on the weekends, when they become depressed, drinks more. That's, there's a lot of nuance here. It's not binary, right?
True.
There's a lot of nuance.
True.
It's case by case basis. It's each individual. We all cope differently. Some people, when they go through a clinical depression, they don't turn to alcohol and drugs at all,
100%.
Right.
Yeah. 100%.
Maybe it's, becoming addicted to fitness.
Well, I was going to say, like, I need to go have a heavy workout right now, right? Because I need to get my mind off of whatever, and it could be like, I need to go for a long run, or I need to, if I live out west, maybe I'm going to go for a long hike up in the mountains and just kind of just decompress for a while.
And that's probably a healthier way of dealing with it. But when I was going through my depression many years ago, for me, it wasn't alcohol. I became addicted to running because I really had gotten into running. And then I was in this terrible, dark place in my life. And I just ran every day. And for a while it helped, because what it did was my endorphins got kicked in. I forgot about my life for a while, and it gave me a sense of control over what felt out of control. So for me, my depression was really about, I felt like my life was falling apart. I was falling apart inside myself, and everything was out of control. And by me running every day, it gave me 30, 45 minutes, 60 minutes of, I get the control back. Now I've got it. And so that took on a life of its own, where I was running way too much. I was actually starting to develop nagging aches and pains because I was developing overuse injuries. But then what happened was my depression grew deeper and darker, and I sunk lower. And then that was when the running no longer helped. My legs felt like tree trunks. I was tired all the time. My body was exhausted, and I'd slowed way down, and running was of no use whatsoever. It was terrible. And actually, I stopped running at that point. And that was when really the shit hit the fan for me in my life. And that was when I finally had to go. And I had been in therapy. I'd actually been in therapy, but that's when I upped the therapy to twice a week. And that's when I went and finally saw a psychiatrist, a colleague friend of mine, for consultation. And he put me on 2 different meds. To help me. And he gave me, and it's escaping me right now, but he gave me a clonazepam. It's those of you who are listening, we give it all the time to cancer patients when I worked in oncology. It's the lorazepams, the clonopins, the Valiums, the Xanaxes, and the name is escaping me. It'll come right back to me, the class of drugs that it's called. But he put me on Klonopin, and it was way too much for me because I was so woozy, and I had my practice. I was seeing clients, and I was in my office thinking, I can't work like this. It's like everybody's talking to me through a glass of water. So I went off of that.
Yeah.
It was terrible. I mean, like, I can't do this. Went off of that. And I just stuck with the antidepressant, which I mentioned earlier. That was game changing for me. That with the psychotherapy over time, over a couple of years time, got me through the depression and pulled me out of it. So there are other things and activities in our lives and hobbies that we can get addicted to. But for today's episode, we are talking about depression and substance abuse.
Let me ask you. So for you, was there this pull towards like a temporary moment in isolation for you? Was that part of the whole running thing?
I totally isolated from my friends.
Yeah.
I mean, so I'm going to go off script here. We can just have this conversation. Yeah. I mean, I remember, I pulled away from everybody.
Yeah.
The isolation was bad. I felt so guilty, and I felt like I was a weirdo because I didn't even understand what was happening to me because I'm not really a depressed person. I don't have a wiring, I never thought, towards depression. Mine was a situational depression, but a deep one because I'm a pretty happy, upbeat, confident person. But man, did I got hit by a 2x4 and I was blindsided and it knocked me flat. Louise, my very good friend, I remember seeing her at pickup. We're picking up our daughters from dance class or some acting class. And I remember her coming up to my window and she's like, "Are you mad at me? Have I done something?" And I was like, and I remember I saw her walking up, like I was looking in my side mirrors and I saw her, I knew she was there in the parking lot. And I saw her walking up, like I see her in my side mirror. I'm like, oh shit, here she comes. Like I did not. And she's like my closest friend. I did not want to have to tell anybody what I was going through. It was weird. Like I almost had like this own stigma with myself that I was dealing with what I was dealing with. And she walks up and like, oh, hi. And she's like, are you mad at me?
That's
and then
funny.
I realized, she's like she thinks I've done. She thinks that I'm mad at her because of something she's done. I said, no, it's has nothing to do with you, and I am going through something. And I told her what it was at the time that I was going through because I was depressed for a reason. I just haven't said it here on the podcast. That's a future episode that I will talk about, which I don't think I've talked about at all on the podcast. But we'll get into it in future episodes. And she was like, okay. So I started to tell my friends more and more because they were like, what is going on with you? You're like acting weird and this is before texting was really big, but like, you don't come around. You're not responding to emails. We don't see you out at our event, girls night out things. And, that was, I wanted to stick my head in the sand or stay underneath the covers and not come out. So that was depression. But I didn't use substances to cope because I had 3 little kids. I don't know. I couldn't do that.
Yeah. So do you, I mean, not necessarily for you. I mean, you can speak to it if you want to, but I'm just thinking a person out there that's listening. So is it that if a person's going through exactly the scenario you just described, is it that they want to fix it for themselves? Like rise up to the challenge and get through the dark to get to the light for themselves? Is that it? Or is it that you don't want outside opinions maybe somebody critiquing it from a point of negativity. Is that bigger? Like, what's the big thing that makes somebody go there and stay there for a little bit?
Well, you talk about depression.
Or isolation in particular?
I think it's different for everyone. I mean, I can't say for, I mean, for my clients over all these years, it's just different for each person. I think a clinical depression clouds your thinking. It's like think about when you're trying to drive through fog. That's depression. Think about that's a great visual for people. Like if you've ever driven through fog and you're like, geez, I can't see. I cannot see. And you turn the fog lights on. If you have fog lights, and you're like, I can't see. This is actually kind of getting dangerous. That's what it's like for many, many people who deal with the depression. Others may describe it differently, but that's why I've heard it described. And that resonated very well for me with my depression.
That's a great visual. If you think about
it, you can't see 5 feet in front
of you. Right? Yeah. So your bubble becomes so small and all you can see is the front of your car, let's say.
And you can't think about your friends. Right. Like, where are you? Like, I can't think.
It doesn't matter what's 12 feet in front of you. It's interesting.
I just got to get out of bed. Yeah. I just got to or not. I'm going to stay here. Or the only reason why I think I got out, I know the only reason why I got out of bed during those days is because I had 3 little kids that were dependent on me. I had to take care of them. And I had a practice. Yeah. Believe it or not, I had a thriving practice. Talk about fake it till you make it. Although when I was in my office seeing my clients, it was wonderful for me because I completely would forget. I could compartmentalize very well, and I could forget my personal life and focus on my clients who was sitting right across from me until they get into them and their issues. But it was those 3 little kids at the time that I had to take care of. And so that I had to get them to school. I had to get them breakfast. I had to, change a diaper or whatever it was I was doing at that time. Really, really rough. So anyways, okay. So that's depression. So let's go back to, what it's like for people who are maybe using alcohol, maybe using, drugs, illicit drugs or prescription drugs to cope, just overusing them to cope with what it is that's going on in their lives. So, what you do see often is this increased resilience when it comes to taking substances. So you're taking more, so you are more resilient, and it's not in a good way. You need more to feel the feelings, because what we're trying to do with substance abuse and depression is to numb out. We really want to just numb out. We'll do anything to escape the way we feel at that time. So, you'll see an increased use of drugs, alcohol, and they're wanting to numb out. They are in a lot of pain. What you often see with people who are depressed and abusing drugs is, you see this, family members talk about this a lot, total neglect of responsibilities. Like they just and coworkers will see it and employers will see it, not coming. Oh, because I know that you've dealt with this with in your workplace, people who come to work late, maybe leave early, people who take long lunches. When they're there, their attitude is not right.
I mean, even something as simple as like their personal appearance is
different. That's a symptom of depression. There you go.
It's right. That could be different too. Also, you're like, wow, I've never noticed you present that way, whatever that means. Well,
you're talking about like you can look more slovenly, not as buttoned up, put together as you did maybe last year. You'll see somebody who, do they even haven't washed their hair in days? Right. That's concerning. I mean, it's really concerning because that when you're looking at open-toed shoes, you can see sometimes dirty toenails, you can see greasy hair. That's a serious depression going on there. Wearing like baggy clothes, oversized clothes, like just looking like
that's commonplace.
Yes,
in this conversation, you're right. Yeah, you're right.
Exactly. And if you're drinking at night, it's hard to get up the next day and go to work. And so there's a lack of care maybe about the job that you're doing. Oftentimes we see finances get really messed up because you might be spending your money on liquor, you may be spending your money on drugs, and you're taking out cash advances on your credit card to pay for your habit, and you need more and more and more. So finances really get messed up.
Another thing too is I think I've seen this where it's like the person is quicker to maybe get angry, and like their reaction time is much quicker. Like they
Yeah.
can't, their level of patience goes down.
They don't have the bandwidth.
Right? Yeah.
They
And
don't
so
have the
they like,
bandwidth.
bam, they snap maybe a little bit faster than they might, or maybe
Right.
they'd never snapped before. Now they do. And it's like, you're like, whoa, what? That isn't,
Behavior changes
yeah,
and
totally.
personality behaviorally
Totally.
changes. Right.
Totally. Yeah.
Right. So something else we also see is they're engaging in riskier behaviors. Maybe unsafe sex. You're hearing about them hooking up, having hookups with people, and you're like, what? That's not. That's not what you. Okay, maybe once, but I don't really know you to be that way. Not using protection and being like, come on, like what's going on with you? As friends and family members, you know your friends and you know how they are. So you would really notice this behavior if they told you, like, okay, what's up with that? Driving under the influence, there you go. I mean, that's a big one. Sometimes you'll see criminal activities. Um, that's less common, but you can sometimes see criminal activities, especially with drug addictions, because that becomes paramount. And that's all you see is this acting out behavior of criminal activity. And it's hard to be patient with. It's hard to understand as family members and friends. And you really could just kind of want to walk away from that person or back away from them. Um, but oftentimes, and I'm always going to say this, you got to look at what's underneath the hood. What's underneath the hood specifically is depression for many, many people.
And isn't that the case a lot just in life? Like, you don't, you come across somebody, you cross paths with somebody in life, and like, you're like, oh, you're irritated by how they talk to you or how they, maybe whatever. And it's like, you got to take a second and be like, wait a second, we don't know what they're going through. Right.
Yeah.
Like, we don't know why they acted that way. They're a complete stranger. Like, give them a little bit of grace. Right.
It's
like,
so difficult
yeah,
not to judge.
yeah, exactly.
And it's important that we don't.
Yeah.
Because we have no idea
We don't know
what's going on in someone's life.
Yeah.
Oftentimes with depression and substance abuse, you're going to see more self-harm. You might see, and now you wouldn't really see this, the outside observer, cutting, self-harm, cutting behaviors, because someone who's a cutter is going to try and cover that up with long sleeves and pants, longer shorts, socks. You're not going to see that. But, as clinicians, we see it and we hear about it. Self-harm, but there also could be suicidal ideation. Hopefully, thoughts of not always a plan, most times not a plan, but thoughts of, I just don't want to be here anymore because they're really suffering and they're in pain. So that's, self-harm is really big. You're trying to feel something, and at least you can feel when you're, cutting yourself. You can feel that when you feel numbed out emotionally or deep on the inside in your heart.
Right.
So cutting, using drugs, anything to numb out and get away and to feel some kind of something. And that's the cutting behavior.
Right.
Often what we see in people who are abusing drugs is, you all probably know this because you've seen it yourself, strained relationships with your boyfriend, your girlfriend, your friends, your family relationships. Their erratic behavior is annoying, is irritating, is hard to understand. So, maybe we've broken our trust in them. Maybe they have neglected the relationship because what becomes most important is the drug seeking and the feeling that they're going after. So it strains relationships big time. And what they will do often is, like I said earlier, really avoid social interaction with you. So, you are annoyed with them and how they're behaving, but now you're not even getting texts or seeing them because now they're into their isolation. It's gone deeper, and for many, many people, with drug abuse and alcohol abuse, they still have the stigma. Society still sends a huge stigma today, which really can exacerbate their feelings of isolation and shame. So this is like, you take all of this, which I just talked about with drug abuse, and then you take what's underneath it, this depression. It's sad. It's a sad state for that person. And that's why it's so, so important to try not to judge. And they may test your patience. They may put you on your last nerve, and at the same time, try your best to throw them grace and to continue to support them. You can do the tough love. I'm an advocate of that. Tell them you love them, and we'll talk a little bit about treatment and support for them. But, I know that it is rough to be around people who, on the outset, you don't always see the depression. You see the behavior. The behavior is annoying as hell. The obnoxiousness when they start to drink, or their just their jerky attitude, or maybe they're acting like they're out of their minds because they're so high. They're not even aware of, they can't even participate in a conversation, or they say stupid things. At first, it's kind of funny. As time goes by and you think there's a problem, it's not funny anymore. Or they don't shut up, talk, 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 because, they're on amphetamines, they're doing that coke, and they need more and more coke. And, they're cocky and arrogant and talkative and all kinds of flight of ideas. It's annoying to be around them. And then you're like, okay, is it you I'm talking to, or is it drugs I'm talking to?
Right.
But it's really important to remember that oftentimes, well, most times underneath it, there's a mental health diagnosis. Okay. Really important.
And that's a good takeaway for all of us that are not the professionals in the room, right? Like for you see it differently.
Yeah.
But for the rest of us, it's like, it's just living life and like understanding that there might be opportunities to rethink how or when you take a moment to pause and look at somebody a little bit deeper, because there might be something else going on that you have absolutely no idea about, right?
And I know that it's really easy for you and I to talk about this and for the listener to listen. I know it's a completely different animal to be living it, because if you and I were living it, I know you, Tim, like I know me, like we'd be annoyed as hell. It's a very human response. You're annoyed as hell at them for the way they're acting because they're making us worried. Let's take our kids, or let's take a sibling of ours, someone we love. We're worried about them. We don't want a police officer showing up at our house at 3 a.m., with hat in hand, giving us some kind of news. Like, you're scared for them. You're worried for them. You're mad at them. You're mad at how, selfish they are acting. They're being, all they care about are themselves. It's very difficult. It's hard to love these characters when they're going through this. It's hard. And, I understand that. And I'm asking you, the listener, as well as the two of us, to remember to try to throw them grace. There's something else going on.
Right.
They got to get into some kind of treatment.
Yeah.
But you can't make them. You can't make them. So we could do a deep dive, but we don't have time in this episode, because another conversation is around boundaries and around tough love, and how do you take care of yourself in the midst of having, I'd say it's more family members and friends, in the midst of having a family member who's abusing substances. How do you take care of yourself? You may know that there's a depression. You may know that they have dealt with anxiety. I hear a lot of people say, yeah, I know that they've been in therapy for that before, but they weren't using drugs before. And, that was something that I could manage. I can be with my brother. I can be with, I can help my kid. I can be there for you all day long with your mental health diagnosis of anxiety or a mood disorder. But this, with the drugs, this is next level, and I'm not here for it. And I get that. And that's around family members setting boundaries. So let's go into a little bit about, what is the treatment and what is the best way for you to support a family member who is abusing drugs and there's a depression going on. Or for you, if you yourself are dealing with a depression or an anxiety disorder, or any mental health diagnosis, and you are using drugs to cope. This is what I would tell you. This is what I think are the best options. Number one, go to counseling, get yourself a therapist. Get yourself somebody who is trained in drug treatment. Okay, CADC is a certification. It's certified addiction and drug counselor. CADC is what you want to look for. So you can go on to the search engine. Psychology Today is very popular. There are other search engines out there that you can search for on the internet and look for therapists in your area who have a CADC certification. Okay, as well as maybe being a licensed clinical social worker or a PhD or a PsyD. That doesn't matter as much to me, but you want somebody who really knows substance abuse. So regular therapy is going to start to really go at what's underneath your behavior of using drugs. And they're the ones who are really going to get at the mental health piece. Okay. I am a huge proponent of, and I'm going to talk about this till the cows come home, Alcoholics Anonymous or a 12-step program. I do believe it takes a village. I do believe that when we are dealing with substance abuse, addictions, it's so powerful and has such a hold on us. Oftentimes, we can't do it ourselves. Some say addictions is a disease. Drinking, alcoholism, a disease. We can't do it on our own. Find that help. Go to support group. There's open groups. There's closed groups. You can go to an open group and you can just go sit in the back. I don't even think you need to say your name. You can just say pass and they'll just pass by you. They're the most non-judgmental people you will ever meet. They're the most wonderful people that I have ever met. I want to go to AA and I'm not an alcoholic just because I want to go and hang out with these people.
Right?
They're amazing. I love them.
Yeah.
They're the most down to earth, lovely, lovely people, and they will never judge you. And just keep going. And if you know somebody who is an addict, and offer to go with them, that really can help. Go with them, or maybe you tell them where the groups are. Or if you're an addict yourself, look for the groups in your area. There are 12-step meetings, literally in most towns in the United States and Canada. Every hour on the hour, there is a meeting, usually in the basement of a church or an assembly hall, or the Lions Club, but you're going to find an AA meeting or an NA Narcotics Anonymous meeting. You can't escape them. They're all over. Okay. So that's wonderful. And they're free. And go to an open one. The closed ones, I think that's different. That's for people they know each other well and they're more permanent attendees, but you start with the open groups. Okay. So that's really important.
Is there a need for volunteers with groups like this? Will they take that? Like if somebody want to jump in and help out?
I think the volunteers are recovering addicts.
Okay.
You're recovering addicts.
Yeah. Okay. Yeah.
Because usually you go on, you sponsor someone.
Yeah.
Once you get into recovery, maybe you'll sponsor someone. And then they're also the ones who will run the meetings, make sure the coffee and the cookies and all that set up. Right.
Okay. Yeah.
Yeah. So I think it is so, so important to get your own therapy, but then get support. Okay. Medication. So let's go back to, okay, the outward behavior is the drug addiction. The inward thoughts and feelings is, for this episode, we're talking about a mood disorder. Maybe you have a clinical, a major depressive disorder. All right. So you might benefit from taking meds like I did hugely. It's what got me through. I was working in oncology with cancer patients at that time. I could not have done that work if I wasn't taking antidepressant. I had to have it because I was so low myself. So it got me over the hump. It created that floor that I talk about. It created a floor that I wouldn't go below that floor. I came up in my mood, and then it created that nice baseline floor that I would no longer sink below. So I'm a huge proponent of meds. Drives me crazy when people in the health and wellness world and in the coaching world are like totally anti-meds. I don't think they know what they're talking about. And I feel strongly about that. And I'm going to throw my name in the hat and say that because meds has its place. Meds are very important. Antidepressants have saved people's lives. So, this is something that if you're dealing with a drug addiction and a clinical depression, I really would like you to consider taking a med. Okay. Doesn't have to be forever. It can be for 6 months. Doesn't have to be for the rest of your life till you're 80. Doesn't have to be for 5 years, but it's something to get you through the crisis. Okay. And also, last but not least, many, many of my clients I've sent to rehab. Many. So, if you're entrenched in addiction, most times, well, I won't say most times, for many people, it is a 30-day program. It's a residential program away from your life. I know people who've gone for 60 days, who've gone for 90 days. They really needed the time away from the environment they were in, the people they hung around, and they did a lot of soul work, psychotherapy. They got completely clean, had established new habits in these programs. For the time they came out, they were really good to go. Okay. So rehab, I can't underscore enough the importance of rehab. So you could do a 30-day, you could do an inpatient, that's more local in your area. And then and what we have are these outpatient rehab programs. So a partial hospitalization program for where it's come and go. So you're there from 9 in the morning to maybe 5 or 6 at night. But you're in groups, you're working on skills that we're teaching you to help you continue to move beyond your addiction as well as your depression. Okay. So counseling and or psychotherapy, support groups, medication management, and if you need inpatient, consider a rehab program. And there's inpatient, there's outpatient, and there's like lots in between. Okay. So that's really important for you all to know about. All right. So there's no shame. There's never room for shame when it comes to mental health diagnoses. I think you all know I'm going to say that. No shame, no time, nowhere, no place. No more shame. Shame can't live in the light. Shame loves the darkness. When you come out with this and you start dealing with this, now you're in the light. Shame will dissipate. It will go away. You don't deserve to feel ashamed. It's just something you're dealing with. You happen to be dealing with it at this time in your life. Everyone's got something. And for many of us, we know someone who this is what they got right now.
Right.
Okay. So there you go. I hope that was helpful. This is about depression and substance abuse. Why do people who are dealing with depression and anxiety go towards substances to deal? So this is part 1. We're going to continue with this conversation in part 2 next week.
Love it.
Okay, everyone. So please don't forget to subscribe, rate with 5 stars, review the podcast. I so appreciate your reviews. It really means a lot. And if you want to reach out to me, please don't hesitate. hello@annamarcolin.com. If you want me to coach you, I can coach you no matter where you are. And if you're looking for therapy and you're in Illinois, reach out to me then too. And I will set up a time to see if we would be a good fit for each other. Okay. Until next time, everyone. Mad love.